If you've had a stroke, or you're helping someone who's had a stroke, whether you're a professional helping them, or perhaps it's a family member, then listen in. We're just going to dissect a little bit about what to do if you can't yet stand, never mind walk. Andy here from Ship's Physio in sunny Devon, England. Where do you even begin? Well, this video is not meant to constitute medical advice on its own or replace advice that you've already had. Mainly, the idea is to supplement what you're doing. To have something in your own home, on your own computer, on your own phone, you can watch and exercise along with. Your very own green goddess in blue and gold. You may notice in the video that I wear odd coloured socks, and that's simply to help people looking in if you've got any disruption of your sense of left and right, or your sense of what your own body might look like in a mirror image, then the different coloured socks are to help you navigate the video. Let's dive straight in with exercises from lying down. Many people who can't stand up, I would almost certainly bet that they actually can't really sit. They may be upright and in a chair, but there's sitting and there's sitting. When I say somebody can't sit, what I mean is they don't have active sitting, meaning they're not using their spine correctly. When their spine moves one way, the head begins to move in the opposite direction. The head is held nicely vertically and not tilted and twisted slightly to one side. Some of that comes from balance problems, and some of that probably originates with eyesight problems. And I'll try to remember to put a link below for the video that I put up a few weeks back, where it talks about the eyes must do these 3 things. Today for our equipment, we're just using a plain old domestic bed. Let's start. I've always argued that both sides of the body have different effects after the so-called ordinary hemiplegic stroke. But for the purposes of the video, I'm just going to say simply that my most obviously affected leg is wearing a blue sock, and it's underneath. I've got a single pillow under my head, and my active side is uppermost. So we're just going to work on rolling and rolling onto the, we'll just call it the affected side, this one. And most people who are having big difficulties with stroke and movement, where they're not even really standing, are probably going to use their active leg, wearing grey sock, plant it and start to push themselves over to roll. And if we're going to overcome the balance problems, what we need to relearn to do is use some weight from our active hand and arm and some of our leg, and start the movement probably with a reach of the hand and arm, and follow it through with lifting the leg up and over to land in front of the stroke leg, the blue leg, so that it looks like, in full, it looks like nearly lying on back, rolling forwards to lie on the side. Or after big strokes, don't want to come fully over onto their side and spend large amounts of their time either on their back or only fractionally turned to one side or another. One of the reasons for that is that it can be very, very frightening to roll towards the affected side. It can be very frightening to roll towards the working side. They're slightly different to treat. Here's the movement again. Should start with a little bit of hand and arm reaching, and then lifting one leg up and over to land in front of the knee. Something like that. And then at full speed, it starts to look smooth and easy and controlled like that. There are a few things that might get in the way of that. Not least is possibly pain in the often paralysed shoulder and arm. That can stop a lot of people trying to do this. If that's the case, you may not be able to do it at all, but there are some things that you might add in. Let's just add in an extra pillow. Obviously you'll be having some help with this. An extra pillow under the chest to take some of the weight. Can we then roll over here? The shoulder is protected in a bit of a gutter made from two pillows. Once fully over on the side, then you can begin to work on just using your working leg and learning that a little bit of movement here, it can speed up the roll, but it can also stop a roll, because now I can't roll over the top of this knee. It will simply block me. So it's both an accelerator and a brake. And with a little bit of practice, even the most frightened about rolling people can learn that some of this movement is actually okay. And once you're here, you can start to play with it to regain control. Can you lift the knee, resting the foot on the bed? This is your working leg, remember. This is the strong leg, a lot of people call it. I just call it the less coordinated than it used to be leg. Because although it's strong and it's working, very often it's less coordinated than it used to be. Feet and toes are usually very much as they ever used to be. Knee is probably pretty good, but is often overworking. But control of the hip joint, maybe not so good. And then the whole of this side of the pelvis and the control of the pull back or the pull forwards or roll forwards as we are lying down. That level of coordination is almost always disrupted. And you'll find small mistakes with that, even in people who are standing, moving and walking quite well. So gradually, using this kind of technique, we start to rebuild the ability to roll, which means, in other words, twisting the spine, controlling the twisting or rotation of the spine. And it's the rotation of the spine that produces balance, and control of the rotation of spine that results in good balance. Then we can start retraining some of the other movements that are needed to help with balance in standing and walking. And the main one is a small side bending movement of the head. And when I'm in this position, what that means is, can I begin to lift my head free of the pillow? You can perhaps see now I can get my hand underneath and lower. Lift and lower. These small side movements of the neck are in no small part responsible for bringing our head back to the upright position when we've slightly shifted our weight from one leg onto the other, which is of course generally what we're doing when we're walking. So this movement is tremendously important. If you want to know what it looks like when somebody doesn't do that, actually the best place to see that is watching film of a chimpanzee or bonobo when they try to walk on two legs. When a chimp or bonobo tries to walk on two legs, the head moves from side to side a lot. It doesn't come back towards upright. They don't have as sophisticated a balance on two legs as humans do.